Just to give you an idea of how serious this is in Texas, we're now averaging more than 10,000 new COVID cases a day in the Lone Star State. Almost 12,000 new cases were confirmed on Thursday. The number of COVID patients in Texas hospitals has been steadily increasing as well since late June. It now stands at 10,791 people in the hospital in Texas alone. And now, as we are dealing with an uptick in COVID-19 cases and a new variant, the governor asked for elective surgeries to wait as hospitals deal with overwhelming numbers. So how are things looking right now? This morning, we're joined live by Dr. Esmaeil Porsa, the president and CEO at Harris Health System, to give us an update here locally. Welcome to Houston's Morning Show.
Good morning. Thank you for having me.
Let's first of all begin with what's happening right now at LBJ and Ben Taub. We know that you guys have just been basically busting at the seams. How is it looking right now?
Let me start, as always, by thanking all of our healthcare staff at Harris Health System, but also all the health systems in this region, in the state, and nationally. After a year and a half of dealing with the pandemic, they're tired, they're exhausted, they're disheartened with what is happening, a very preventable surge in COVID. To answer your question, things are bad. My hospital is oversaturated. We are at over 100% capacity for ICU patients and regular hospital beds. As of this morning, I have 5 ICU status patients at LBJ emergency room waiting for a bed.
It's just so sickening to be able to hear you say that, because we know that those lives are on the line because of it. So what are you doing at this point? We've seen tents going up around Houston trying to handle that COVID-19 overflow. Are you all involved in any of that?
We are. We just erected a tent outside of the LBJ hospital. We had the tent up previously during the previous surge. We had taken it down because of decreasing numbers. We have always maintained the tent outside of the Ben Taub hospital. But to your point about the tents going up all over the city, there is the reason for that. And this is really important. The point that I'm trying to make to the public is that this surge is very different than the previous 2 or 3 surges that we have experienced in this community. The numbers are not only going up, they're going up faster than ever before. You know, my numbers right now is at 130 total COVID-19 patients. It took me almost 3 months to get to from a baseline to that number in the previous surge. It has only taken me 6 weeks to do that this time around. This is frightening. This is a disaster waiting to happen. And until and unless we all get together and do the right thing, getting vaccinated, wearing face masks, socially distancing, we are in a world of trouble. And I just want to emphasize that to our public. This is not about personal choice. This is not about individual freedoms. This is about us coming together as a community and doing what is right. You know, your personal choice for smoking does not negate our ban on public smoking. Your personal choice on wearing a seatbelt does not negate our seatbelt laws and does not give the parents permission not to apply seatbelts to their children. And your personal choice to drink and drive does not negate our drunk driving laws. This is not about personal freedom. This is about the healthcare emergency.
And when you paint that picture, it does seem very grim. And I just wanted to ask you if you could explain what that situation is like in those tents. Do you have everything that you need to help protect these patients who are so very serious? And you can't help but wonder, what is a tent like in Houston in August? Is it climate controlled? How does that work?
They are climate controlled. There's air conditioning inside the tent, but yes, we have the equipment. Equipment right now is not a problem. It's the staffing. You know, to make the situation worse, along everything else that I just told you, we do not have the nursing staff that we had previously. I have lost nursing staff to retirement. I have lost nursing staff to just being sick because of COVID and other illnesses, because again, they're exhausted. And I've lost nurses because they're going elsewhere for much higher paying jobs as travel nurses.
Well, we know that the governor is bringing in some medical workers, and we certainly hope that they can come your way to help from out of state. Dr. Porsa, thank you so much for joining us. We know that you are incredibly busy at Harris Health System. Thank you for sharing your valuable time to tell us what's happening right here in our own backyard.
Thank you. Appreciate it.